us now is Dr. Leo Nissola, an immunotherapy scientist in San Francisco. So first of all, Leo, from a medical perspective, who should be getting vaccinated first? What is the balance between age and health conditions when making this decision?
It's not an easy decision. And by the time Trump left office, officials have warned us that they were left with no actual vaccination plan. So the Biden administration had to start from the beginning. And when they took office, they really tried to speed up the vaccination efforts as much as possible to ensure that people that were more likely to have a severe form of this disease were able to get vaccinated first. So far, at least 60 million Americans have already gotten the first COVID shot. And that is 92 million doses administered, meaning at least 18% of the U.S. population has already developed some immunity against this virus. Now, the federal administration distributes these vaccines to the states and lets states decide based on their population, which groups should be receiving this vaccine first. So while some states have more elderly, others have more healthcare workers. So the decision there becomes not standard across the United States. While some states like California have prioritization based on tiers, other states like Alaska have already released the red tape around these vaccines, making it available for every healthy adult. So without clear guidance from the federal level, states are left on their own to decide who should get it first.
Do you think that's okay? Do you think that there should be federal guidelines in place, or that states should have the ability to choose what they think is right?
Well, I do. I believe in federal guidance, and I believe in standard approach to vaccination. If you see successful vaccination campaigns across the world in underdeveloped countries, which I've worked on it myself, they are usually standard, and the approach is all hands on deck. So letting a state ease restrictions or not vaccinate a specific group doesn't help you when mobility is still occurring within the country.
Now, there are some states that have interestingly put smokers on the vaccine priority list. What is the reasoning there over, groups who have pre-existing health conditions?
Right. So the issue is supply. So the important thing is preventing new deaths. The important thing is avoiding hospitalizations. So in that case, preventing patients who have diseases like diabetes, obesity, and are more likely to die from the disease or develop the severe form of this disease to be immunized first. So with that rationale, health officials in some states have ordered that smokers are allowed to receive the vaccine first. Although it's controversial for the general population, it's medical science. We want to prevent deaths. If that means vaccinating people that are sicker, that means that we need to vaccinate smokers first. So protecting people, it's what we're trying to do here. And if you were to take any message from this is do not smoke. It kills you.
So I guess, the other group that I want to ask about is pregnant women, because there have been a lot of questions around whether or not it's safe for pregnant women to get vaccinated, but they're also on the high priority list because we've been seeing very serious cases of the coronavirus within this group. What is your stance on that? Should they be on the higher priority list?
I think the first thing we should do is just study these patient populations in clinical trials. Randomized clinical studies are the only way we're actually going to know if they are safe and effective. While real-world data already proves that there is some immunity being passed from mom to unborn by the body and afterborn by the breast milk, I don't think we should be trying to do science with the population without controlling the environment. And that is making clinical studies that are appropriate to understand if these vaccines are actually safe for mom and baby before we release them to the general population.
All right. Well, thank you so much for joining us, doctor, and giving us that breakdown. We're now out for a